Greetings, one and all. I am Dr. Vikrant Pawar. I am presenting our article, A Rare Case of Brain Gliosarcoma in Pediatric Age Group. This is the case report. The authors are Dr. Tushar Soni, Professor and Head of our unit, Department of Neurosurgery in Srimati NHL Municipal Medical College and SLP Hospital, Ahmedabad, Gujarat in India. Dr. Mahendra Patel, third year resident doctor, and myself, Dr. Vikrant Pawar, second year resident doctor in Department of Neurosurgery. Primary malignant CNS tumors account for 25% of all CNS tumors. Gliosarcoma is a rare variant of glioblastoma multiforme. This tumor was first reported by Straube in 1895, but it was Pagan and Gross who described it in detail in 1955. It is characterized with biphasic tissue pattern, with glial and sarcomatous component. The glial portion consists of astrocytes with nuclear atypia and mitotic figures. The sarcomatous portion consists of neoplastic mesenchymal cells with associated reticulin formation. We'll have a look at the picture of the histopathological slide later. These cells are spindle shaped and demonstrate nuclear atypia, increased mitotic activity, and necrosis. The case report is about a 16-year-old healthy boy who came to our OPD in good general condition with history of right temporal heavy cranial region headache since 1 month. He was fully conscious, oriented to time, place, and person, vitally stable. The neurological examination and fundoscopy of both the eyes was normal. MRI brain suggested of well circumscribed hyperintense lesion of size approximately 43 into 33 into 26 mm in right temporal region. This is the MRI image of this patient. As you can see, there is a lesion. This is a post-contrast MRI image of the patient brain. This is the lesion, which is nicely demarcated, and the measurements are mentioned. Intraoperative, these are the intraoperative photographs of the patient. As you can see, the wound operative field with the tumor in situ. After proper necessary preoperative workup, surgery was planned. Right temporal parietal craniectomy and excision of tumor was done. Procedure was uneventful. Post-operative patient recovered very well without any neurological deficit. This is the post-operative CT scan of the patient. You can see the right temporoparietal bone defect with perioperative changes in the right temporal region. This is the histopathological slide that we were discussing a short while. The discussion: Gliosarcoma is a rare variant of glioblastoma in the pediatric age group. These tumors are having biphasic pattern in form of both glial and sarcomatous components. Males are commonly affected than female. If the proper surgery is done, and patients usually have no neurological deficit post-operatively. Post-operatively, when the wound gets healed, radiotherapy and chemotherapy are advised. Conclusion: Gliosarcoma is one of the rare variants and represents only 2 to 8% of all glioblastoma tumors. Only the age group affected is 40 to 60 years, male preponderance of 1.8 is to 1 to female. Gliosarcoma is having poorer prognosis as compared to glioblastoma. Post-operatively, radiotherapy and chemotherapy are advised to increase the mean survival of this patient. The mean survival of these patients is just 6 to 14 months, but radiotherapy increases it from 8 to 15 weeks, while chemotherapy increases survival of these patients from 12 to 24 months. Maximal safe resection followed by radiotherapy and chemotherapy appears to be the best current treatment for these tumors. The drug of choice for chemotherapy is temozolomide. This is the post-operative photograph of the patient with no neurological deficit. These are the references that we considered while preparing this article. Thank you. Thank you all.